Hello, this is Dr. David Green, CEO of the Washington Pain Network. Today's topic is what you need to know about fibromyalgia. Fibromyalgia is a connective soft tissue disease that involves chronic, spontaneous, and widespread musculoskeletal pain, as well as recurrent fatigue and sleep disturbance. The condition presents with multiple tender spots on the body, usually found in the back, neck, chest, hips, arms, and legs. In the past, it was referred to as chronic pain syndrome, psychogenic rheumatism, fibrositis. 3.4% of women in the U.S. and 0.5% of men have fibromyalgia. Usually it's between the age ranges of 30 to 50, and 75% of those actually go undiagnosed. So there are various guidelines. The American College of Rheumatology says if a patient has a history of several areas of aches or pain for a minimum of 3 months, at least 11 of locations on the body, 11 of 18 are significantly tender, and these are the 18. In between the knees, elbows, around the clavicles, and then 2 areas in the front of the neck, 2 in the back, and then around the shoulders, and then the buttock areas. Close but not quite, then that means the patient is diagnosed as myofascial pain syndrome, but the treatment's the same. So Journal of American Medical Association 25 years ago divided it into major and minor criteria. Generalized and chronic aches and pains is stiffness present for over 3 months in 3 or more anatomic regions. Once again, several tender points, and then no other identifiable condition that the symptoms represent. So basically, you go through the algorithm of what it could be, and then if it gets to the bottom, fibromyalgia. You can see the minor criteria there with the fatigue, headaches, neck, shoulder pain, sleep disturbances. Oftentimes, it's a diagnosis of exclusion. You've tried to look and see if it's something else, and if it's not, then fibromyalgia comes into play. Treatment options, alternative medicine, in the Mayo Clinic proceedings of 2005, all of these showed benefit. Acupuncture, chiropractic, PT, massage, aromatherapy, homeopathic, spa baths, relaxing herbals, music therapy, and yoga, all of those have been shown to be beneficial. For medication options, there are various that can be used off-label, such as antidepressants, anti-inflammatories, muscle relaxers, Tylenol, opiate medications, Lyrica or Neurontin, they're called membrane-stabilizing drugs, sleeping aids, and then there's Myers cocktail IV infusion treatments, which several studies have shown to be beneficial. And it's just a lot of vitamins and minerals in an IV. Now, there are several FDA-approved medications. Lyrica became the first FDA-approved drug for specifically treating fibromyalgia back in 2007. On the heels of that, Cymbalta was FDA-approved, and then Savella was FDA-approved in 2009. We actually don't know how any of these work on fibromyalgia. It's an unknown mechanism of action. How well do these treatments work? Well, a pilot study 5 years ago of a Myers cocktail, most subjects experienced relief as compared to baseline, but there were no statistically significant differences seen between the Myers cocktail and placebo. So it might work, it might not. It's such a low-risk treatment that a lot of people still do it now anyway. There is really no cure for fibromyalgia, and it's a very challenging condition. New studies show that patients can decrease symptoms dramatically through multimodality treatment. The top non-operative pain management in Washington is through the Washington Pain Network. There are several clinics throughout the state accepting over 50 insurances, with over 25 treatment options being provided. Overall success rates for pain are over 90%, with the board-certified award-winning doctors. Visit us online today at washingtonpainnetwork.com, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.